Hello everyone, it's Dr. Dave. Hopefully you're all doing well, enjoying the start of your week. Looking forward to your Tuesday. Coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update for Tuesday, July the 6th, 2021. I'm going to share with you 6 areas of health and wellness news and information somewhere around this video. You can read through all 6 areas. If you'd like a copy or if you ever have any questions, you can DM us on social, give us a call here at the clinic, or send us an email. We, of course, would be happy to help you out. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, you just never know what your body is capable of when you give it a good environment to do what it's designed to do. And hopefully we'll share some of those tips with you based on some of the latest and greatest in the research and literature. And let's see what we have for you today. Some of these you're going to be able to check out on your own. They may be a little more specific and you can get a little more in depth with it if you like. The European Society for Paediatric Gastroenterology, Hepatology, and Nutrition in June 2021 looked at celiac disease rates being higher in people than expected. So if you or someone you know has this gastrointestinal challenge, it's a chronic immune disorder triggered by gluten ingestion. So you can read more about that on the Daily Health Update and then maybe Google the study and get a little bit more specific with it. The screening early in life identified more kids with celiac disease and allowed for better treatment. So it's something that you may want to read about, is not only for yourself, but even if you're looking at taking care of those people around you. The BMC Public Health Report, June 2021, talked about coffee and how it may protect the liver. Data from the UK Biobank showed that an estimate regular coffee consumption, decaffeinated instant or ground coffee, is associated with up to a 21% reduced risk for chronic liver disease over a 10-year time frame. Of course, there are many studies on coffee, and coffee has its good points and maybe some detractors. It may depend on your genetics, your ability, if you're a slow or fast metabolizer of coffee, and also on how much you're going to consume. So I think most of the health benefits are found in smaller cups. And then sometimes increased health benefits in some areas with more cups, but also some potential not so good side effects. So coffee is an interesting thing to read about. Make sure you do your due diligence and see if the amount that you're consuming is right for you. Of course, if you didn't have coffee in your life, you might still be okay. But many of us do enjoy a good cup, so it's good to know what you're getting into perhaps. The Cancer Causes and Control report from June 2021 talks about sedentary behavior and how it almost doubles colorectal cancer risk. People who are sedentary 10 plus hours a day are almost 2 times more likely to have colorectal cancer than those who are sedentary for 5 or less hours a day. So it's not just about our physical ability to move and stay active in life, but sedentary behavior does have an impact on our overall quality of life and function through our organs, glands, and other parts of the body as well. So our body does really need motion to survive. Human Reproduction, June 2021, looked at prenatal stress and how that may affect the development of young girls, especially with an earlier onset of puberty. So if you're expecting and or plan on having children, you may want to look at that to see what can be done about that, and to try to have good support during your effort of bringing in a wonderful child to this world, and to make sure prenatal stress is not a part of that plan or formula as best you can. Along those lines with pregnancy, the journal Medicine, June 2021, looked at mid-pregnancy vitamin D status and preterm birth. They looked at 24 studies and they found that vitamin D deficiency during the second trimester of pregnancy is associated with a 33% increased risk for preterm birth. So, of course, we looked at vitamin D many times on the Daily Health Update, and having within normal limit ranges of vitamin D during that second trimester, probably all the time, no matter what you're going through, will have some benefit. But in this case, especially with the risk for preterm birth. Finally, Physiotherapy Theory and Practice, April 2021, talked about muscle fatigue and instability in low back pain patients. An experiment involving 24 non-specific chronic low back pain patients and 24 age-matched individuals without a history of back pain revealed that fatigue in the lower back muscles that help to bend backwards, as well as the hip muscles that pull the hips out to the sides, resulted in a greater degree of postural instability among those with low back pain. So some very specific muscle assessments going on there, and basically talking about the ability to stabilize the lower back and coordinate its function. So including exercises to address that postural instability as part of the treatment program for patients with chronic low back pain seems to be a good idea. So it's good to get some hands-on treatment and make sure that someone is assisting in guiding your body to sit and move better, and then to learn some things that you can do on your own to support that process of encouraging it to sit and move well. It may bring some good results over time. Okay, so don't give up on that back of yours. It can be better. That's your daily health update for Tuesday. Some good nuggets in there and a little bit of research to do on your own if you're looking at trying to support your health and wellness. Never time or effort misspent when you're looking at making improvements or keeping yourself well. So good on you for being here. And we'll be back tomorrow, Wednesday, middle of the week, with your daily health update. It'll be a pleasure to see you then. Take care.